Today on day 5 of the Fatty Liver Docu class, we really focus on things that threaten your liver health and greatly increase your risk of disease. Dr. Stuart Nunley will talk about how conventional dental procedures can ruin your health. Dr. Chris Shade will help you to avoid many liver detoxification mistakes. And Dr. Tom O'Brien talks about how poor food choices can destroy your liver and overall well-being. So let's get started with my conversation with Dr. Stuart Nunley. We'll talk about how most cavities are filled with the wrong dental material, how the nervous system can be negatively affected by conventional dental procedures. We'll also talk about the hidden infections in the mouth that are extremely toxic to the liver, plus much more. Enjoy my conversation with Dr. Stuart Nunley. Stuart, thank you very much for coming out from good old Texas to spend some time with us. Why don't you just talk first about what got you so interested in biological dentistry?
Well, I always thought I was holistic in that I knew that placing mercury fillings was not the correct thing to be doing. So many years ago, over 35 years ago, I abandoned the use of mercury fillings. But about 20 years into my practice career, I began to have neuromuscular issues myself. And to the point of it, over time, I was finally referred to the ALS Center in Houston, thinking that I had Lou Gehrig's disease. As it turned out, I did not have Lou Gehrig's disease, but I had a mercury toxicity issue. From having worked around mercury, even though I had not put mercury fillings in many, many years, I still had been removing those fillings from my patient's mouth without taking precaution for me or my staff. And so about year 20 into my practice, I began to have these neuromuscular issues that really, quite frankly, scared the devil out of me. And I finally went to Montreal, actually, thinking that I had ALS. I was going up there for treatment. And prior to that, I had my mercury levels tested to see what they might be. And sure enough, I had the highest mercury levels I've ever seen. And so, as it turns out, I did not have ALS, but I had a mercury toxicity issue, which many times will mimic various autoimmune diseases. And it was about a 3.5-year course of being sure that I wasn't re-exposed to mercury, doing detoxes along the way, and a whole host of other things that finally led to my recovery. And as a result of that, I thought, well, there's no way I can go back to a traditional way of dental practice, not only for my patients, but also to protect my staff and myself. So that's what happened. My practice was literally transformed from what I would say was more of a cosmetic practice to a very holistic practice.
We're going to be talking a lot about how these dental toxins affect liver health in particular, but I'm sure you can appreciate how many people out there still never hear about all this being an issue. I mean, forget about the fact that most conventionally trained dentists who might be listening to the story right now from you have no idea that something like mercury-based silver fillings, the exposure to that mercury vapor as it gets released in the air, would be such a threat to their health, right?
Well, you're exactly right. Our very dental community is unaware. It's a sad thing because neurologically, dentists and dental staff have terrible neurological track records. We always rank number one in suicide. We rank number one in depression, divorce, one thing after another. And no telling how we truly rank in terms of autoimmune diseases with respect to the rest of the professional community. We in dentistry somehow lose our knowledge, or we choose to lose our knowledge of biochemistry and chemistry. We all learn it, and then we forget that mercury is considered the second most toxic element on the planet. We're going to be exposed to it in our profession. We forget that, and we fail to take the appropriate precautions to protect ourselves.
This might be a tricky thing to communicate in our discussion, but we were both talking about this before we turned on the cameras. Years ago, even in the health agencies that we have in the United States, they were saying how mercury doesn't even get released from these fillings. But then, quite by chance, this morning before having this talk with you, I check on the internet, and the FDA is recognizing, it's admitting flat out that mercury vapors do get released from these dental amalgams, these silver fillings, and that it's a low-level amount, and that it does lodge into the brain and into other tissues like the kidneys. But the next sentence is, it's safe and effective, nothing to worry about at all. I mean, you got to be shaking your head at something like this, right?
Well, you have to be. There are reams and reams of published data to demonstrate that even the smallest amounts of mercury can be harmful. Who wants an extra atom of mercury? I mean, why would you want to expose yourself to any additional mercury when it's as toxic as it is? So there's no denying that the mercury is released from a mercury amalgam filling 24/7. I mean, we've known that, and obviously now the FDA recognizes it. But to say on the backside of that it's such a small amount that it's not harmful is, in my opinion, I would stand totally opposed to that opinion, because mercury is not an element that you want to be exposed to, period.
I think people need to understand that there's a lot of politics behind all of this, at least in my opinion. And at the very least, it is unscientific. That was the word I was thinking about as you were trying to talk about this, because on one hand, they're also admitting in a paragraph or so down the page that I looked up today that this stuff, mercury in particular, bioaccumulates in the body. But again, in that paragraph, the very next sentence, they say this bioaccumulation has no effect on the rest of your body. And they don't cite a single study. They don't cite a reference as to what is the basis for this kind of conversation. So I know we're about to talk about how this toxicity affects liver health, but I think it's already obvious that it does. Common sense tells us that. But you have to wonder why they continue to spit out this drool to people as if we're not smart enough to get it.
Well, it's because they're not paying attention to the science. And I'm just telling you, I'm living proof that you can bioaccumulate lots of mercury, and that it can have dire neurological consequences. And the beautiful thing about it is we can, over time, get rid of it. We can't get rid of all of it, but we can function again normally. It took me several years of going through fairly drastic measures to get my mercury levels down to a point where I didn't have neuromuscular issues. But I know that it's possible, and why we would continue to go along with the mantra of it's no big deal to be exposed to minute amounts of mercury on a daily basis, it's beyond me.
So throughout this entire event, we're highlighting the importance of liver health, as I know you understand, and how the health of your liver has a lot to do with the health of the rest of your body. Everybody gets that who's watching us. So if you get somebody that comes into your office, and let's make it really simple for the audience, liver cancer, and they've got dental issues, On the surface, maybe a lot of people would think, what are we talking about here? Oral health, toxicity in the mouth has some impact on the liver. How do you help people to make that connection?
Well, you can't separate what goes on in the mouth from the rest of the body. And the liver is typically, we consider the liver as the chief detoxifier of the body. It probably does it 90% or more of the detoxification, and the kidneys do the other 10%. But when it comes to liver, whenever we can take and lift the load off the liver, then it can function the way it's supposed to. The liver becomes overwhelmed because of a toxic environment we live in. And with regard to dentistry, we can put a lot of pressure on the liver. So we could start with this. Once again, mercury alone is a tremendous pressure for the liver to detoxify. We rely on this beautiful little compound known as glutathione to help take mercury out of each one of our cells. It can then carry it through various pathways to the liver. If the liver is too congested to handle that and pass it out through the route we'd like it to go through, out through our intestines and into the feces, if it's too pressured, then it'll kick it out the other way, and then it puts pressure on our kidneys, because our kidneys then can help take over for the liver. Or it can kick it back into the bloodstream so that it's reabsorbed. So having a healthy liver is very, very important in terms of being able to detoxify dental toxins.
And Stuart, just for a moment, I think a lot of people would, maybe if they're new to this information, still not be making the connection. Mm-hmm. But in a simple way, I'll let you explain it a little bit more if you like. Just the mixing of the saliva. Isn't that the idea that the vapors, the mercury we're chewing, we're brushing, it mixes with saliva, it gets swallowed into our digestive system, it gets absorbed into our lymphatics and our blood. Mm-hmm. I mean, this is where stuff here in the mouth ends up in other places of the body, right? It's a very simple way of putting it.
Oh, absolutely. No, you have it exactly right. We can swallow it. We can heat it up with a cup of coffee and have the vapors come off of it and then absorb it through our tissues. There's no barrier to mercury. Mercury, there's the blood-brain barrier is nothing for mercury. The placental barrier is nothing for mercury. So mercury goes where it wishes. It loves to go to nerve tissue because of certain little compounds in the nerve tissue that it binds to. But that's not necessarily the only place it'll go. It also loves your thyroid. It loves your fat tissue. Mercury will go wherever it wishes. And so the job then of the liver is try to help clear that. And unfortunately, oftentimes the liver is either overwhelmed or it's diseased. Maybe it has a malignancy in it, and it just can't function the way it needs to. And so we build up, we bioaccumulate mercury day after day.
I get a kick out of this too, and I don't mean to make it as a joke, but here it is again. No scientific basis for the statement, but I'm sure you've heard this a million times before, what I'm about to bring up. They recognize, conventionally speaking, that mercury in fish, that's a no-no for a pregnant woman. Mm-hmm. Like somehow this one small section of the population has got to be so careful about mercury in tuna. But yet there's never a discussion of the millions of people that have mercury-based silver fillings in their mouth. And we also hear so much about how these days, especially, environmental toxins are such a threat to our health. Again, they're just skipping over something that millions of people are walking around with every day.
Well, they are skipping over it, and there's no reason for it. Why can't we just admit mercury fillings can be a health issue? whether you're pregnant or whether you're a child or whether you're 90 years old. Why can't we just admit that mercury comes from mercury fillings 24/7, and any additional dose of mercury is not healthy? Why can't we just say that? And then why can't we at least say, if we're going to say what we do about methyl mercury in fish, why can't we just say, make the same statement about any other exposure of mercury? Because the methyl mercury in fish, we used to think was maybe the most serious exposure. The truth of the matter is there's good data these days to suggest the ionic mercury that comes from mercury fillings is even more toxic. So we just need to call a spade a spade.
So now we get to some other issues with oral health that I think equally get ignored a lot or mischaracterized. I'll say it in a nice way. The root canal treated teeth. These toxins that are coming from root canal treated teeth and cavitations, which I have a personal interest in, as you know. Both of these areas have a lot of toxicity. How do you help people to get rid of it? I guess maybe I should first start asking you, how do you first talk to people about this? Because again, most people conventionally speaking, if they go look up on the internet right now on the first page of Google, there's no mention of what we're about to talk about, is there?
Right. Well, how do we, that's a great question, is how do I talk to someone about a root canal when they've never had any information that might contradict that a root canal is totally safe? How do you bring that up? And here's how I bring it up, Jonathan, is that in the first 20 years of my practice, I probably did at least 2,000 root canal procedures. And somewhere along year 20 or 22, I became exposed to some research that pointed to the fact that root canals might have a toxicity associated with them. Well, I was interested enough that I flew to Lexington, Kentucky, and I spent the day with a wonderful biochemist there who was doing research on root canals. His name was Boyd Haley. I came away that day saying I could never do another root canal. I said, Dr. Haley, how many root canal extracted teeth have you examined in your lab? And at that time, it was thousands that he had examined. How many have you examined that weren't toxic? He said, not one. And so I literally came away that week. I brought in all the patients that I was going to do root canal procedures on for that week. And I said, in good conscience, I just cannot do another root canal. I feel like I've been exposed to the data now that makes me really question whether a root canal, although it can save a tooth, it makes me question what it might do to your systemic health. And so I still have that same sort of conversation with patients. Most patients are referred to us by physicians who have already informed them of the problems that root canals can pose. But occasionally we do have those patients who come in and they're not aware of the situation. And so I just simply make patients aware of the data. We educate them. There's plenty of literature now available to educate patients. And from that, they can help make their own decision, or we'll partner with them in making decisions on what the next best treatment is for them.
Stuart, I know people that come to see you, they already get it. And I think most people watching us, they understand that too. But what you said is still so difficult for the new person out there. Because when I go back to if someone were to go search, they're listening to us and they go, I want to check this out. They literally say that a root canal treated tooth, conventionally speaking, gets rid of bacteria in the tooth. It removes unwanted bacteria.
Right.
And that it is so good for your oral health and your overall health. That is literally what they're saying on so many different sites on that first page of a search. What is really going on when you do a root canal therapy? What is happening to the tooth? Because I don't think people really understand, like, if they're cleaning it out that day, how could it be so infected? How could it be so filled with toxins that spill out into the rest of the body? Maybe you should explain what really is going on when someone gets one of these treatments.
The treatment in itself is designed to remove the nerve from the tooth, and that oftentimes does eliminate the pain from an abscessed tooth. But as the dentist is removing the nerve, he's also severing the blood supply to the tooth. And the research is very clear today that in an infected tooth, when the endodontist or general dentist takes the nerve and the blood from the tooth, the blood vessels, you still have remaining bacteria. So now you have a dead tooth that's still infected, and it has no blood supply to help eliminate further infection. In other words, a tooth that becomes infected, if it has a blood supply to it, at least you can deliver your own immune system to it. At least you could, if you were given an antibiotic, you have a chance of delivering an antibiotic to it. But once the nerve and the blood supply have been severed from a tooth through a root canal procedure, you have a dead tooth with no way to deliver the body's own immune defenses to it. Well, that's a wonderful little way to incubate bacteria. So now you have a nice warm environment and nothing there to contradict the overgrowth of bacteria. So now the tooth becomes more and more infected. The body has to keep that in check through the surrounding ligament and bone and blood supply around the tooth. It becomes a health challenge because now you're occupying the body's own immune system 24/7.
You've extracted these root canal treated teeth. When you pull out, I know with my own wife, watching it myself, pulling those out even when they look like okay on x-rays, when they get extracted, I'm wondering what you saw in your experience now that you've been working with this, how infected they are, or have you ever found any of them not to be infected?
I've never found one not to be infected. I've submitted, I'm sure, thousands now of teeth, either for a DNA analysis to determine what bacteria are in the root canal treated tooth, or over the years I submitted, I know, at least 2,000 teeth to the toxicology lab that I talked to you about earlier in Lexington to see how toxic the teeth were. I even published an article on this in 2012 in the Journal of Orthomolecular Medicine that demonstrated the very best of the best root canal treated teeth are toxic. So I've never seen a one that wasn't toxic or diseased. In fact, if you look at the literature today, most of the literature likes to talk about root canal treated teeth that have a lesion on them. And now that we have something other than just a two-dimensional x-ray, we have cone beam technology, which is CAT scan technology for the jaws and for the teeth. We can look at a tooth in 3 dimensions. We know now there have been 17 studies worldwide to determine how many root canal treated teeth actually have lesions on them or very obvious, blatant infections on them. 40% of those teeth worldwide in those 17 studies demonstrated that they have blatant infections. Nevertheless, when we submit teeth, root canal treated teeth that don't have lesions on them, these blatant, obvious lesions, when we submit teeth that look like a normal tooth on an x-ray or a cone beam, I never see those come back any better in terms of their bacterial infections than the teeth even with the lesions on them.
And let me just jump in for a second, Stuart, because the way I'm interpreting this, correct me if I'm wrong, I'm listening to you. Most of the time, in so many cases, let's put it that way, people are not in pain. You don't see the presence of those lesions. Mm-hmm. The root canal treated tooth is infected. It's spilling out into the body. It's polluting the liver. It's polluting blood, lymphatics, you name it. And it's really challenging the immune system. And the way I look at it, our immune system is designed, the beauty of it is to recognize threats and to keep us safe from harm. Okay, we get it. But now if you're constantly burdened with this idea of dealing with infections pouring out from your mouth throughout your whole body, now you're getting distracted. Now you're going to be compromised, and you're not really going to be able to deal with things like cancer cells that float around in our bodies all the time and are designed to be recognized, destroyed, and escorted out of the body. So here it is, we're being distracted with all these infections from the mouth. And that's where I see people get all these problems later on in life. It's these unrecognized infections that are pouring into the rest of the body.
You mentioned a couple of things that really stuck with me there. One is patients don't have pain, and so they and or their healthcare provider don't pay attention to the root canal as being a challenge to their immune system. It's not a good way to look at things. There are many diseased entities like, well, most cancers are not painful, quite frankly. Periodontal disease is hardly ever painful. Most disease states don't start out as painful. They can reach an acute point, or in the latter stages of disease, they may become painful. But for some reason, in dentistry, we've decided if it's not painful, we ignore it. Well, that's a terrible criteria for determining the success of treatment. So we've used that particular criteria, a lack of pain, as determining whether root canal procedure is successful or not.
And cone beam technology that you say we have now, is this really a definitive way for people to detect quite quickly if stuff is going on with root canal treated teeth? And also I mentioned cavitations to you before. Maybe quickly, for a minute or so, explain what cavitations are and how do we figure out if we have these infections or not?
Sure. A cavitation is typically a spot in the jawbone. It can be upper or lower jawbone where a tooth has been removed. That's where we see these most often. Cavitations happen not only in jawbones, they happen in other bones. The hip is the next most common bone. It can happen from trauma, and a cavitation basically is an area in a bone that has lost most of its or all of its blood supply, so that the bone has become osteonecrotic or dead bone, and then that area becomes contaminated with bacteria. So we can see it in any bone, but the most common areas are in the upper and lower jawbone, most typically in wisdom tooth extraction sites. And when it comes to cone beam and wondering whether we can see these definitively with a cone beam, or can we see pathology on root canal treated teeth definitively with cone beam, and the answer is, unfortunately, no, you cannot. It's a helpful diagnostic tool. It's better than we had with the standard two-dimensional dental x-rays. But it still is not, it's still not 100% accurate. Many times we suspect that there's a cavitated area in a jawbone. We look at that on a cone beam. We cannot see it. We make a small incision, go to the area, and there is a cavitated there, as confirmed by a pathology lab, as confirmed by DNA testing. So now we wish that we had a 100% diagnostic tool, and we may have it again someday, but right now we do not.
So Stuart, glutathione, the master antioxidant, I think we should shine a light on this. How do these dental toxins that we keep talking about in the mouth, how does it impact glutathione levels, which I think a lot of people are grossly deficient in?
Yes, and no question. And as we age, our glutathione levels drop off. And so we want to do everything we can to protect glutathione levels. And dental toxins, especially mercury and heavy metals, love to occupy glutathione. And so glutathione grabs onto mercury. It holds it firmly And that's what its job. Its job is to take heavy metals out and other toxins. But when we do that, when we occupy our glutathione with mercury, then the glutathione is not available to take care of other toxicities. And when you have, for example, a 24/7 release of mercury from a mercury filling, then the poor glutathione molecules all become saturated, can't do their job, and we become more and more toxic. Very, very well known in the literature. There's another toxicity from dentistry that we really haven't talked about yet, and that's a toxin that's been identified now. It's derived from particular bacteria. They're in root canal treated teeth. They're anaerobic. In other words, they don't live on air. They're, interestingly enough, the same bacteria that cause the endotoxin problem from leaky gut. In fact, the literature now is talking about leaky teeth. We have leaky teeth and we have leaky gut. Same endotoxins that come from leaky teeth and leaky gut cause a whole host of new problems. Everything from cognitive decline and blatant Alzheimer. There are even papers now that associate dental bacteria and Alzheimer's and other cognitive issues. And just a whole host of other conditions, some of them autoimmune, fibromyalgia being very, very common. All of these things that amp up inflammation, which, by the way, glutathione tends to downregulate. All of these things that tend to amp up inflammation from mercury fillings and from these other toxicities occupy our glutathione.
Yeah, it's interesting. You're saying that as we age, glutathione levels are dropping. Vitamin C levels are just practically nil, and most chronically ill people. That's what I feel like this message is so important for people who want to avoid illness, but especially those people who don't feel well out there right now.
Right.
You've got these essential substances that are so important to have throughout our whole body to keep us safe from harm. Those are really low. And then we're talking about obviously the toxicity in the mouth, but so many other environmental toxins as well that seem to keep going up and up and up every year we've been living, Stuart, the last 10, 20 years, you know?
No, they do. And even now, occasionally I'll have a physician who's not in the holistic realm, but he'll question, why would we want to use elevated levels of vitamin C for our patients? Well, first of all, it's a fabulous antioxidant. I bring it up here because it's a great way to help maintain your glutathione. Vitamin C in itself is a poor chelator of heavy metals, but when we take elevated levels of vitamin C, we help keep our glutathione in the state that allows it to grab hold of heavy metals, mercury in particular. So you're right. As we age, I think we have to amp up our antioxidants to help support those systems like glutathione that help detoxify us.
Yeah, it's interesting. We'll talk a bit about gum disease perhaps later on, but, leaky mouth, leaky rest of the body, just as an overall concept. This is really important, what you just brought up, in terms of people realizing leaky gut is not just leaky gut. Leaky mouth is not just leaky mouth. You let these things go on too long. Leaky liver, you will get a leaky liver. You'll get leaky circulation throughout your whole body. All of this gets compromised, and no, you don't get sick. Maybe this is, God forbid anybody gets sick that quickly, but maybe this is inherently what the problem is. Nobody is getting so sick and falling down right away from all of this. It is years and years of breakdown until that bathtub, the analogy I use all the time, till that bathtub gets too filled up with toxins and compromised issues, that then all of a sudden it overflows, and now you've got yourself a real problem to take care of.
Oh, that's exactly right. These bodies are marvelously made, and when we're young, we can handle just about anything. I thought I was bulletproof, quite frankly, and at age 48, all of a sudden I had this amazing downturn in my health. Well, there's a tipping point for all of us. For some people, it might happen when you're 22. For some people, it's 82. For most of us, it's middle age. We've had just enough toxicities to get us to a point where the bathtub's full and then it runs over and all of a sudden we wake up one morning and we can hardly get out of bed.
Can you speak for a moment about the difference between the toxicity that we find in root canal treated teeth versus the cavitations, which we only talked about for a few minutes, but is there a difference? Are they the same?
That's a great question, and the answer is we think there's really no difference. When we look at the DNA spectrum of the bacteria in root canal treated teeth and in cavitations, they're almost always identical. However, I will say that over the years, in analyzing these cavitation lesions, I've honestly seen a greater variety of anaerobic bacteria in these lesions than I have even in root canals. So the fact again here is that most cavitations are not painful. There is a variety that is, but most are not. Is not a reason that we should use to not treat them. Cavitated areas can be a huge challenge to the immune system. I've seen this over and over again. When a patient comes with some bizarre health condition and they've seen 30 other physicians before they come to us, and the physician finally, one of them has said, well, maybe it's where you had your wisdom teeth removed 25 years ago, 30 years ago. And sure enough, we clean those out. We get a DNA test on them. They're full of bacteria, and those patients all of a sudden feel like their health has been returned in a very robust way.
Just to jump in, when it comes to the cavitations, again, how you know to detect it, it has to be sent off for DNA testing, or when you described before about cutting the gum a little bit and going in, is it mushy in there? Can you visibly see that there's a cavitation? How do you figure those things out? You
can visibly see it. Most often it looks like a dirty oil slick because when the interior of a bone, where we consider the marrow of a bone to be, we call that in these bones, we call that medullary bone. When we see that bone, all bone marrow, by the way, is somewhat fatty. But when a bone becomes anaerobic, when it loses its blood supply, then it becomes uncharacteristically fatty. It begins to develop degenerative fatty cysts within the marrow or the medullary bone, which is under pressure. It's under a pressure 2 to 4 times that of the surrounding bone. So when we make a little incision and use an instrument that's designed to go right through the outer part of the bone into this cavitation, we will see this spill out like an oil slick. It's full of degenerative fatty cysts and bacteria. And by the way, interestingly enough, these are also full of heavy metals. Bones that do not have a good blood supply are a reservoir for heavy metals. So when these have been analyzed over the years, it's not uncommon at all to find a load of mercury inside a cavitated lesion.
So let's get into now how we protect the liver in particular from all these dental toxins. But after listening to what you just said, I would imagine some of these procedures, just real quick also, I have to bring this up, it could be a real risk, I think, for people I'm thinking who have like a lot of health issues. And they're in that office and you open up that gum and you see all this nastiness in there. You got to be very careful that this stuff doesn't spread around throughout the body, right?
Well, it is spreading around the body prior to it being surgically treated. So would we pose somewhat of a risk to a patient when we operate on that and clean it out? Yes, we're going to cause somewhat of a bacteremia. The patient needs to be very well supported when these procedures are being done. So the interesting thing is in the offices that I know around the world where this is done in a very safe way and the patients are supported, there's very rarely, I can hardly think of instances where patients have had poor outcomes. So part of that support could be high-dose vitamin C. Part of that support could be doing everything we can do to get a patient out of an amped up state and a sympathetic state into a parasympathetic state. That may involve acupuncture and acupressure. All sorts of adjunctive things can go on in terms of treatment for patients to allow them to heal well, to allow their body to be able to handle a little uptick in, say, a bacteremia. But again, our bodies are designed to handle these things, and if we give them the proper support, they can do well.
Oh, so that's a great point, though, also for people to keep in mind. It's the support that you keep saying is before the procedure and also especially afterwards as well. This is a great learning opportunity for the person. Wow, I was toxic. I've got these health issues. I want to help protect my liver and the rest of my body. So you mentioned vitamin C. What else do you talk to people about, coach them so that they can really protect themselves going forward?
You know, it's difficult for some patients when these areas are going to be treated because they're already so sick and they feel so poorly that they're discouraged and they're having a hard time they're having a hard time doing any of those things that we associate with a healthy lifestyle. They can't even get out of bed to take a walk around the block. Their vitamin D is low because they can't get sunshine, and they don't want to supplement with extra vitamin D and K2, which is a fabulous thing to do in advance of treatment because you want to build bone, and there's not a better bone maker than vitamin D and K2, especially that combination. So we oftentimes will see these patients who are just ill and who don't have a good quarterback to support them. So it's our job, I think, then to do everything we can to support them beforehand. And we will recommend those things that we know are healthy and bone-building things to do. And then when they arrive, we want to do things right then to support them. High levels of vitamin C, even intravenously, acupressure and or acupuncture, all those things to help stimulate and open up these meridians to heal. We don't think much about that in Western medicine. We always think, we somehow tend to avoid the energetics of the situation and that every cell and tissue has a current running through it. But we want to make sure that all of those energetic pathways are open so that the patient can heal. So acupressure, acupuncture can be a huge help. And then other things too, like listening to a patient and actually hearing their condition, praying with the patient, and actually asking for help in getting these patients well. There are a whole host of modalities that can be huge in terms of helping a patient get well.
It's amazing as I'm listening to you speak here. This is something that's still to this day, I think, difficult to actually bring up like this, right? Of course, we're not having a problem talking about it. But to convey that message to someone that's new. Back in the 90s, when I interviewed Dr. Bernie Siegel, he was already doing it for years and years. If someone felt so nervous about something, so scared about something, you know what? He told them, don't do it. If they felt good about something, if they wanted to do something, he said, go ahead, do it. Even if people around you didn't think it was a great idea. So talk about this energy medicine that you keep bringing up towards the end. How important is that? And how you also brought up that there are some obstacles there when people are depressed, low in energy, brain fog, all of these issues connected to a dysfunctional liver, toxicity in the body that's built up, that's too much. We're really dealing with those things. But you're giving a lot of hope. There's a lot of hope there for someone who just mentally and emotionally gets to that place where they say, you know what? This matters to me. It's important. I trust the healthcare provider I'm with. Boy, is that great for their overall outcome, the results that they're going to get, one way or the other, just their attitude, right?
Their attitude and having a sense of hope. Patients without hope don't do well. And I know what that's like because I got there myself in my own health journey. There was a point in time where things looked pretty bleak for me this side of heaven, for sure. And so I love to be able to listen to a patient and, you know what, and to not give them false hope, but to give them hope. We do have amazing bodies, and I've seen over the course of my career, if you can imagine this, in a dental office, having seen some of the most amazing things in terms of health challenges go away after dentistry is done. I want to be able to give patients hope. Part of that's listening to them. Part of that is helping them to realize that, you know what, I can get well. I can get well. And so I think all of that's very, very important in terms of outcomes.
Without a doubt, another thing I would add to that, as we're talking about those people out there who are suffering with health problems, and now, not just intuitively, they might know flat out, they have problems in their mouth that must be addressed. How important it is not just to have hope, which I'm not downplaying, how important it is to have the right people around you, though. Because like what you said about people in the house may be against what they're doing, that can be really problematic. Okay, so we get that. But what I'm thinking about in particular is to really make sure you have the right healthcare providers around you to couple your hopeful messages with a strong dose of intelligence and a lot of experience. So to have the right people around you, like an experienced biological dentist who's already seen what it's been like to clean up toxicity in the mouth and to take away that burden from the rest of the body, especially the liver, the digestive tract, the brain, all of these things, you know intelligently what this really does from your experience. To have those kind of people around you is so important, especially if it's not you. You don't know, right? You're scared.
Absolutely. Well, emotional support is absolutely, it's hard to say where it might rank, but it ranks up there very high. But by the same token, if you don't eliminate toxicities in a very practical way, in a very safe way, you've still got the toxicities. So sometimes we will see, for example, a patient who has literally a miraculous turnaround in some degenerative disease almost overnight. Well, that could have been an electrical issue. Electrical issues you could clear up very, very quickly. You can restore a current that goes through a system. It's done all the time with acupuncture and acupressure and all sorts of devices. On the other hand, toxicities we don't typically lose overnight. We don't lose a mercury toxicity overnight, and we don't lose the toxicities associated from an extracted root canal overnight. Oftentimes those take days to weeks to months before a patient gets well. In my own case, it was about a 3.5-year journey of doing just about everything I know pretty right in terms of eliminating mercury toxicity. But when we don't have the emotional support, either from our caregiver or from family, it's a huge deterrent to success.
I don't know if you can rank it for us, but in a few minutes here, can we talk about how these dental toxins get removed from the body? Is it more a function of what the liver does for us or the kidneys? I'm even thinking of those people that might have one kidney only. Is there one organ that is more important than the other in terms of really just helping us to get rid of these toxins?
The liver is the most important. However, we excrete most of the mercury that comes off of mercury fillings, and that's the ionic form of mercury. We excrete most of that through the kidney. When we amp up our levels of mercury, and that can happen in a number of ways. It can happen, for example, even in the simple thing of being constipated and not being able to eliminate. When a patient cannot eliminate well, they build up their levels of toxicities, mercury being one, which puts an additional burden on the kidney in the particular area of the kidney known as the proximal tubules. And now we have a tremendous challenge to the kidney. So ideally, we excrete mercury via a glutathione pathway, which takes it out through the liver and then through our intestines and out through the feces. But when that gets backed up, as it does so often in this day and age, Chris Shade talks about this effect just of living in a hyped up sympathetic state all the time, where we simply cannot eliminate when we can. We're in a nice parasympathetic relaxed state, that we build up these levels of toxicities, and that puts undue pressure on the kidney.
Yeah, that goes back to what we were talking about before in terms of what you, I'm sure, educate people on before they even get these procedures done. There's so many degrees of dehydration and how important it is to get good, clean water into you, how important it is to get those bowels moving. For me, this is what explains so clearly, yet I can see where so many people are still so confused when they don't understand this part. I don't get it. Why is it I'm struggling and someone else had a similar situation and they seem to be improving or feeling so much better faster? What's the difference between them and me? Degrees of dehydration. What if you're constipated? You don't have that good hole, not to get too graphic, but large bowel movement every single morning. You're not emptying out as well as somebody else. That person who's having trouble eliminating, like you say, is going to tend to struggle more mentally, physically, and emotionally.
Oh, no question. It's a buildup of toxicity. You have to be able to eliminate it. There are other ways, too. I've found in my career that patients who have a difficult time sweating, if you can't sweat, you also struggle with toxicity elimination. It's a wonderful way and a gentle way to help eliminate toxins. Well,
yeah, when you say sweat, it doesn't even necessarily mean, especially for those people who are weak out there, that they have to go run 3, 5, 7 miles or something. They can do this in a sauna, correct?
You can do it in a sauna. Sauna's a great way. You can do it in a detox bath. You can make your own detox bath with Epsom salts and those sorts of things to help sweat, to induce a sweat. It's not uncommon, interestingly enough, the more toxic we get, the more difficult it is to sweat. And so, but breaking through and having that as an additional pathway to detoxify is a wonderful thing. Plus, it takes the pressure off your liver and kidneys.
But it is a great thing also for people to know, not that I'm trying to push it away. It would be great if people do have trouble with moving their bowels and stagnation and a lack of good quality circulation, how important it is for just good old-fashioned walking, how important it is to exercise and move and breathe at a little higher rate. That's still comfortable, at a little higher rate of heart pumping and blood circulation. It's all good.
Absolutely. And there's nothing, you're right, that makes us be more regular, make our bowels be more regular than exercise, even gentle exercise.
Stuart, we're going to talk about finding the right dentist, because everything we're talking about, it really comes down to finding a good support system. It's great to have good support at home. Very important to have the right dentist. We'll talk about that. But before we get there, what about at home? Some things that people could do right away to take better care of their teeth and gums. What do you suggest? You know,
the thing that we found may have the most powerful impact on having a healthy mouth is the use of a water pick. Obviously, brushing, getting the plaque off your teeth is important, but a water pick jets into that little crevice between the gum and tooth where it's very difficult to get the bristles of a brush. Floss doesn't get down there. So by literally forcing the bacteria out of that little pocket, you do much to improve your oral health. One of the things that we encourage people to do, and this is based mostly off of looking at the bacteria, when we retrieve the bacteria out of that pocket and look at it under a microscope, we can see what's there. And oftentimes people have an unhealthy microbiome, especially if your gums are bleeding, if they're puffy, if they're tender. We know that microbiome has gotten out of order, and now you have way more of the deleterious or bad bacteria than you do good. You should have some good bacteria in there. You want good bacteria. You do not want to sterilize the field. But if you have too many of the bad, what you want to do is put in your water pick, you want to put about an ounce of 3% hydrogen peroxide. Good old garden variety, brown bottle, 99-cent bottle of hydrogen peroxide. Put an ounce of that in the water reservoir of the water pick. Put another 7 or 8 ounces of water and use that and turn the water pick up to about as high as you can stand it. Eventually, you'll get it up to the highest point. You're intentionally jetting out the anaerobic bacteria that are under the gum line.
You know, that's interesting what you said, just real quick. Someone with gum disease, sensitive gums, maybe you turn down that water pick. But it's like working out, like going to the gym. You'll get better and better, and that will be a good sign, right? When you're less sensitive, it means the gums are getting a bit stronger, tightening up. I know that, using a hydrofloss, like what you're describing, actually can bring down pocket size. You don't want to have big pockets around your teeth, right? It can actually shrink it down, which is a good thing, right?
No, correct. You're absolutely right. And the patients will be able to literally visualize and feel the health of the gum tissue, and they'll be able to turn that dial up. Yeah, great point.
And there's also some herbal and essential oils, things that make it more unfriendly, I should say, right?
No question.
These nasty bacteria to, populate in the mouth, no?
No question. And even sometimes we'll recommend some colloidal silver. Colloidal silver has a wonderful antibacterial effect without eliminating all of the bacteria.
Okay, so now we're at a point of trying to find the right dentist. How do we go about doing that? It's important.
I think a great way to do that is first you might go to the International Academy of Oral Medicine and Toxicology's website. That's IAOMT.org. And there are close to 1,200 dentists there worldwide who at least are very familiar with an integrative approach to dentistry, where they would certainly be using materials other than mercury. I would think all of them. And not only that, but many of those dentists have now been trained in removing mercury fillings in a very safe way. There's even an acronym SMART listed on that website for smart dentist. If a dentist has been SMART trained, and that stands for Safe Mercury Amalgam Removal Technique, if they've been trained in that technique and are certified, then they should be using a very, very safe technique to remove a mercury filling and then replacing that with a biocompatible filling. We now have in dentistry, we have a number of filling materials that are biocompatible. Companies have become more and more aware of this issue, and so many of these dentists are using and keep in stock a whole range of biocompatible materials. I would say once a patient identifies a dentist, maybe off of that website, and there are even several others, but that one's the largest. But then I would interview the dentist. I would make sure that if they are SMART certified, that they are truly using all the protocols in that technique so that they can be sure. And another thing they might do is try to find a friend or another patient who's been to that dentist. And really, I would ferret this out and try to make sure that I'm finding a dentist who truly is going to look at me, not just from what goes on from here up, but literally who is concerned about my whole body and how I might be impacted by whatever I do from a dental standpoint.
Yeah, what you just said quickly at the end is an important thing for people to understand. They might even have gone to biological or holistic dental conventions, and I'm not putting them down. They might have a genuine interest in it. But the level that their office is at, they may not be there yet in terms of maybe you should talk for a moment about some of the things that people ought to know they should experience if they wanted, for example, to take mercury out of their mouth safely. What are some of the things that they'll actually be witnessing around them when it comes that day? I mean, not that you would want to get to that point where they're sitting in a chair that day and they realize, I picked the wrong guy, stop, I have to go on an appointment, I'm out of here. But what are some of those things that you should be aware of that really lets you know you're in good hands?
That's a great question. Great question. If you only could pick one thing that the dentist would be doing when he removed your mercury fillings, you would want to make sure that he put a little rubber gizmo over your tooth that's called a rubber dam. The rubber dam protects you from getting the particulate that comes off of a mercury filling when it's drilled out. It keeps that from going down your throat or grabbing onto your tissues, your mucosal tissues where you absorb much of the mercury. So that's the first line of defense. And if you're a patient and you're seeking out a dentist who is going to protect you, that's going to be the first thing he does. You would think in an office that where he's going to protect you from the particulate, that he might want to protect himself too. So most likely you're going to see the dentist wearing a mask, a mercury vapor mask, respirator, and his staff also that are in the room would be wearing that. You would want to be making sure that the dentist who's doing this also protected the rest of your body. So there would be a drape over you that protected you from the particulate, because he's not going to grab every little bit of it. He's going to get most of it with his suction, and there will probably be a very, very large extra suction in the room that takes any of this ambient mercury out of the air and the particulate. So those are the chief things. The other thing I would ask a dentist when you go interview him about the procedure is I might ask him, what are you doing to protect the water supply here from the mercury that comes out of people's teeth? And if that dentist is not using some sort of a mercury separator to keep it from going into your lake or stream, then I would look for another dentist, or I would encourage him to get a mercury separator.
What about simple other things besides the mercury aspect? Do you have toothpaste with fluoride in it? We haven't talked much about fluoride, but other little quick things that maybe you could give me a little insight that somebody could ask on the telephone before they even arrive at the office that might make them pop up a red flag, like maybe I ought to skip this one and go call somebody else. I mean, not to get, too complicated here, but anything else to ask?
Oh, I think that's a great question you might ask. In your dental office, is the use of fluoride a routine procedure? And if it is, then they're basically not following what they would be instructed in the International Academy of Oral Medicine and Toxicology, because we all know that fluoride is a toxin. And although there are some possibilities of it helping to eliminate bacteria if it's applied topically to a tooth, the routine application of fluoride is a procedure that, in our opinion, should be avoided. It has too many potential health consequences. Fluoride, for example, loves the thyroid even more than iodine loves the thyroid. And so fluoride can be a health issue for you. And we don't want to be exposing ourselves to toxicities, and fluoride is certainly one of them. What would other questions be? Well, the question would be, how often does your dentist attend other sorts of continuing education other than the traditional educational models? Does your dentist attend toxicology and other meetings frequently? I would just make those simple questions, and more, maybe more importantly, I would look to see where some of his other patients might be and question them.
Before I let you go, just for another few minutes, just so people are aware of this, another area that can really pollute the rest of the body are these unaddressed gum disease issues that people have. I mean, I looked up the Centers for Disease Control and Prevention. they're actually flat out saying quite easily to find on searching in the internet, half the Americans have gum disease. That's a whole lot of people. So really important to make sure that you're not bleeding in the gums, right?
Oh, that's true. A bleeding gum should be addressed, just like if you had a bleeding fingernail, you'd wonder what's going on here. We need to address it. So bleeding gum tissue is something that deserves attention. The interesting thing is, though, many gums don't bleed and they're still infected. And so one other thing that a patient might find by going to an IAOMT type dentist is that many of those dentists will have a microscope in their office. And when the patient comes in, prior to their having their gum tissues treated, a sample of that bacteria can be taken, looked at under the microscope, and then we can determine exactly what bacteria are there and treat the patient accordingly. Because when you look in the literature now, you will see that the numbers of articles that associate gum disease with virtually every known degenerative disease are unbelievable. Heart disease, stroke, cognitive issues, Alzheimer's disease, fibromyalgia, and virtually every autoimmune disease is exacerbated by or caused by gum disease. So it's a